All right. Hi, everyone. Good afternoon. Thanks for coming to this 2024 last event of the DEI Science Consortium. Today, we have an exciting panel, so I'm not going to speak a lot and let things get started soon. My name is Frankie Kung. I'm co-director of the consortium alongside with Dr. Zoe Taylor. Before we start the panel today, I want to give you a heads up that we would like to thank the reviewers who have participated in helping to select the Faculty Paper Award, which will be announced officially next week. So stay tuned for the award-winning paper, and we'll be advertising it, and then it'll be a fun activity for you to read the paper and see how that is contributing to the literature. So today it's really my absolute pleasure to introduce the moderator for the Global Health panel today, Dr. Cami McBride. Cami is an Associate Dean for Research in College of Health and Human Sciences and also a professor at Human Development and Family Science. Fun fact, before Cami moved here, we were actually in the same university in Hong Kong, the Chinese University of Hong Kong, when I was doing my undergrad degree. I didn't have the honor then to take Cami's class because I didn't take any developmental psychology class. So if you're an HDFS, don't look at me funny. But but I always wanted to learn from Cami. So this is really both a professional and personally meaningful moment to have Cami with us today. So I'll pass on the mic, and then Cami will lead us into the discussion and the introduction of the panelists today. Thank you, Cami.
Thanks very much. Working? Okay, great. Oh, I can hear it now too. So yeah, I've been back to my former institution, and I saw that Frankie was giving a talk like 2 weeks later, and it was very, very popular. I heard so many amazing things here and there and everywhere. It's really great to have that association. Okay, so I'm gonna be the moderator, and this is how I'm going to do it. I'm going to ask some questions, and for each person, feel free, whoever you are, whenever you want to ask follow-up questions. I'm going to start by introducing each person, and then they're going to introduce themselves more with their research. So it'll just be short, and then just feel free to chime in. So it is my great pleasure to introduce, first of all, Jennifer Brown. Professor Jennifer Brown is an associate professor for psychological sciences. The second participant is Jonathan Boucher, an associate professor for White Lodging, J.W. Marriott Jr. School of Hospitality and Tourism Management. Our third participant is Dr. Laura Murray Kolb, professor and head of the department for the Department of Nutrition Science. And finally, Dr. Nasreen Lalani, assistant professor in the School of Nursing. So thanks everybody for being here today, and I'm going to start with my first question, which is for each of you, and we'll start with Jennifer. Can you please provide a 2 or 3 minute summary of a main way in which your research and or practice is relevant to the topic of global health?
Sure. Well, thanks for coming, and it's a pleasure to be on the panel today. So I'm Jenny Brown. I'm faculty in psychological sciences, and my research is really thinking about how we can design culturally appropriate interventions to address health disparities in the realm of substance use disorders, infectious diseases like HIV, and sexual and reproductive health. So I've had the great privilege of doing some global health research in a variety of very different locations. So I started as a postdoctoral fellow at Emory University and did my first global health study in St. Martin in the Caribbean, and then followed that up with some work in Russia, which was quite different. And most recently, I have current projects in South Africa, where I'm partnering with a university in the University of the Free State, along with community partners like Love Life, which is a large NGO focused on sexual health and adolescent well-being. And then I just finished up a project designing a new alcohol reduction intervention for women living with HIV and hepatitis C in Russia. So I love global health research. I love domestic research as well, and I think it poses some really unique opportunities to partner in unique ways to try and address some of those pressing health disparities we see both here in the US and then also abroad.
Hi, everybody. Oh, doesn't work? Where's the button? Should be on there. It's on. It's on? Oh, okay. Thanks for coming. Hi, everybody. I'm Jonathan from think of it as the Division of Consumer Science, then you avoid the long name. I'm actually not directly a health researcher. I'm a little bit apart in the college in that way, maybe. I am an international development scholar. I use a lot of different disciplines with fairly heavy emphasis on economics. So I work a lot with smallholder farmers in developing countries. All my research is international. I don't do any project in the US. The way it connects with health the most is on research on food safety and how do we help smallholder farmers understand a lot of the issues around food safety. One of the big problems with food safety is that a lot of the contaminants are unobservable, and so there's a big deficit of even pure awareness in information. But even if we give people information, then the economics of producing safe food are really very much against smallholder farmers in countries where the regulatory market and infrastructure often doesn't exist or doesn't work very well. And so I do a lot of work again on interventions to help farmers produce food that are of not so much better quality, but higher safety level, fewer contaminants. Yeah.
All right, I'm Laura Murray Kolb, as you heard, and my work really focuses on micronutrient deficiencies, primarily on iron deficiency. And iron deficiency is the most common nutrient deficiency in the world. It affects individuals, all individuals, but it most commonly affects infants, children, and women of reproductive age, and those who are of lower socioeconomic status and who have lower education. And so much of my work, we've had iron deficiency, we continue to have iron deficiency in the US, in Europe, but a lot of that has been taken care of with different fortification policies that have been put into place. That's not the case for much of the rest of the world. And so there are really high prevalences of iron deficiency in especially sub-Saharan Africa and Southeast Asia. That's where we find the highest prevalence. And so much of my work has been done in those areas. If there are faculty here or even the students who are here, I was thinking back to when my first international study occurred, and I was a PhD student and went to my advisor. I was in a lab where we worked with animal models, which was great. I mean, I learned a lot, but I said, I want to do a human study. And he said, okay. He was trained as a human nutritionist, but had sort of left that and started doing animal work. And so I said, that's what I want to do. And anyway, ended up having the opportunity to go to the Philippines and to do some work there, looking at rice, one of their staple crops, right, to see if we could maybe biofortify it with more iron and see if that would be bioavailable, could it be absorbed, would that help reduce iron deficiency and anemia. And so since then, it's just been, I've had the pleasure of working in primarily, like I said, sub-Saharan Africa and Southeast Asia, Nepal and Bangladesh and Pakistan and Rwanda and Ghana and India and lots of different places, Guatemala, Bolivia, Brazil. And so, so most of what I do, even though we do study women and children in the US also, a lot of what I do is really relevant to global health.
So I'm Nasreen Lalani. Most of my nursing was from Pakistan, and then I did my PhD from Canada, and then I came here to US. So I have a lot of international partners. My research is basically around looking at the health equity and disparities around aging, palliative, and end-of-life care. And most of my work is in the rural communities of Indiana. But I am also partnering with collaborators in Pakistan because aging, and especially the effects of aging on the caregivers because they are caring for them. So basically, I'm looking at developing culturally sensitive interventions to help to promote the self-care and the well-being of caregivers. So that is my research lab, and currently we have developed blog writing intervention to promote the self-care with the collaborators in UK, and that is the same intervention will be applied with postnatal mothers in UK. So I'm working with some partners in UK and then in Canada because when I was doing my postdoc, I also worked around how to develop the post-disaster recovery and resilience. So, and there was a big wildfire in Fort McMurray, Canada in 2016. So that work is still going on. So basically it is also looking around how to develop interventions or help the families to improve their resiliency and well-being. And other projects, like I'm also focusing on how the spirituality and faith, because those are also some of the aspects of well-being, taking a family-centered approach. So yeah, these are some of my work that I'm currently doing and kind of developing on that, taking those on the larger scale.
Great, thank you so much for your introductions. And I think I'm going to shake it up a little bit, and I'm going to start with Laura to ask you the next question, which is, well, really the first question. The first question as a discussion. Could you please give an example of how or why culture and global issues should be considered, but often are not, in research and clinical practice?
Whew. Starting off easy, huh, Cami? So, I think that if we're really serious about, I think most of us, especially in HHS, a lot of what we do is really centered around making lives better, right? Centered around improving lives. And it should be for everyone. And so I think that, it's important that we go outside of our own bubble, if you will, to recognize that there are others out there, and to say, hey, the way we do things or the interventions that we come up with that work for this group might not work for another group. And, we're only going to know that if we include these other groups in, the research that we do, in our thought processes, in our implementation, in our interventions. And so I think, if we are really serious about improving lives for everyone, then that just requires that we don't just stay within what we know. Was there a second part that said, why don't we?
If you have a particular example, I think that would really help to illustrate.
Yeah, ask the question again, just so I can. Sorry, I should have.
Can you give an example of how or why culture and global issues should be considered, but often are not, in research and or clinical practice?
So sometimes I think they're not because it's hard. I'm just going to say that, right? Like I think sometimes it's just easier for us to keep doing things the same way we've always done them. So some of it I think it's just hard. Some of it is we have limited resources, and that also affects what we can do. But again, I think, to give an example, I mean, for me, when people say, why do you work where you work? I say, because I go where the most need is. That just seems to make sense to me. And so if I were to study iron deficiency and interventions for iron deficiency, here, first of all, I would say, well, just take a supplement. I would, Don't quote me on that. I know I'm a nutrition professional, and I'm supposed to be telling you to eat a better diet. You should eat a better diet. But a supplement can take care of a nutrient deficiency when it comes to iron deficiency, right? But that is not necessarily an affordable solution in many places of the world. it's not necessarily an accessible solution in many places of the world. So that might be one example of why it's really important to go outside of, our own sphere, to say, yeah, there's other populations out there, and there are solutions that may work here that may not work there.
Thank you so much. Could I ask you to answer the same question? What do you think?
Yeah, so I believe that culture is a way that influences the people's behaviors and their actions. And when we talk about improving life or quality of life, it is very important. And given my research area, like end-of-life care, if you are communicating about the decision-making around end-of-life care or care about end-of-life care, culture plays a very important part. And especially the ethical principles that we used in our research. For example, autonomy. Autonomy is seen very differently in an individualistic society and in a collectivist society. I still remember when I was interviewing people in Pakistan in a hospice setting, and I had to interview a daughter who was taking care of her father at the in the hospice setting, very close, near to end of life, and she was not very comfortable talking to me because she wanted the permission from her mother-in-law. So that was the cultural piece, because that's the those are the things that we have to be very careful when we are talking to people and what we are talking to people. And I also noticed that when some other people are sitting with them and I'm interviewing the participants, they were not very comfortable. And especially if they are their relatives, mothers, fathers, elder brothers. So we need to be aware of those things, especially while designing our research study also, in the methodological sense also, and also generally, we need, for example, people don't have that much, people of different cultures don't have much trust on the white physicians talking to them about the palliative care or taking decisions around end-of-life care. So we need to be careful at what language, how we are communicating, and what cultural values and practices those people are practicing, so that to influence the care in the right direction. So.
Thank you so much. Jonathan, could you answer?
I was going to give you a specific example from one of my projects, working with peanut farmers in Senegal. And the problem is peanuts grow in the ground, and so they're one of the crops that is very susceptible to aflatoxin, which are, I had never heard that word before I worked on the project, but which is a compound produced by a fungus that grows in the soil everywhere in the world. In the US, we have a really good system for monitoring peanuts, maize, a lot of crops. And so when they are contaminated, we throw them away and we can eat safely, us. But in Senegal or in a lot of countries in Africa, that system doesn't exist. So we worked with the farmers about training them on how to avoid aflatoxin and dry the peanuts properly. The problem with aflatoxin is that it costs time and money and energy to deal with it and make sure that your peanuts are properly dried. Potentially, there's some inputs that you can apply to the field to help, but all of that costs money. But there's no system to test for aflatoxin content in peanuts at all. And so why, as a farmer, would you incur all that cost if the next farmer who's not is selling the same exact peanuts, as far as everybody can tell? And so that problem of a lack of an incentive is really the fundamental problem of food safety in that context. And the example about global issues is that the market for peanuts in Senegal is, some of it is highly regulated. The government has a monopoly on purchasing peanuts. It doesn't test the way it should, but it buys at a much lower price. Recently, with structural reforms of the World Bank, the IMF, that kind of approach, some international buyers are now allowed to buy peanuts in Senegal at a free market price, at a free price that is not regulated. And so a lot of buyers come from outside of Senegal, buy peanuts with no care for aflatoxin whatsoever at a higher price than the government. And so farmers are directly facing this kind of global shock of international markets for peanuts, and some buyers not caring whatsoever about the level of aflatoxin, buying the peanuts at actually a higher price than the government. And so having to deal with that, the health consequences, because then the impact is that everybody grows peanuts without caring for aflatoxin, peanuts of lower quality that have more contaminants, but they also end up eating them. The farmers are both producers and consumers, and they also sell on local markets. So then everybody ends up eating worse quality peanuts that are more contaminated because of that global force of international buyers coming into the market.
Thank you. Jenny?
Sure. Well, I'll add on. I think it's really important to think about culture broadly and to understand we have one perspective to bring as U.S. Western researchers, but if you can really work alongside people that are working in the community around these issues and take kind of a culturally humble approach to help understand their perspective, whether that's designing an intervention or considering whether this intervention would even work given the policy or the political climate, it can just be a really nice model to advance the work in a way that you hope will be more efficacious than had you not done that. I think unfortunately we have this perspective, well, it's worked for one population, so why wouldn't we roll it out everywhere for everyone? And there's something to be said for that when you have limited resources, but we know unfortunately that perpetuates a lot of these health disparities, especially among those who are particularly marginalized, whether that's because of their racial ethnic identity or other identities. And so there's a real opportunity, I think, if you can sort of work alongside and think about how to incorporate culture into the work that you're doing. And that can be locally or it can be somewhere international as well.
Thank you very much. And again, if anybody in the audience has like a question or a comment, you can let us know. I'm going to go on to another question. And I think I'm going to skip around a little. I hope that's okay. And I think I'm going to start with Jonathan again, if that's okay. And this is, what challenges related to conducting global health research have you encountered in your work? And how have you overcome them?
There's too many to list in 1 hour in the afternoon, actually. I thought about that question a little bit in advance, and I thought I would emphasize, I think the biggest challenge for me, at least, 'cause I do a lot of applied field work. I don't download any data set. Sometimes I wish that was my research, but and so I think the biggest challenge in that sense, in that context, is to find local partners. And this is where the cultural aspect also plays in, right? Finding a partner in itself may not be that difficult, but finding a partner with whom you work well, either an institution or an individual or a series of individuals, is actually really difficult. I'm not sure that I have a magical solution or really great solution to overcome it. At some point, you're going to have bad partners, and you kind of trudge through one project with them and then swear never to work with them again. And then that's actually really useful learning. It doesn't just apply to international work, even any project, right? The university has resources actually to help with that. I can think of the Laser Pulse project run out of engineering. I don't know if you've ever heard about it. They often have RFPs come out for international work, some health-focused and some other topics. In the College of Ag, the IPIA, International Agriculture Office also helps find partner, connect with people internationally. But I think that's really kind of a really big challenge. It's very important to find a good partner.
Oh, I will second that, and to the nth degree. If you're physically not able to be there, you really have to feel comfortable that you trust folks to help with the work, do the work, be fiscally responsible with funds that are getting sent overseas, to follow IRB guidelines, any number of things. So you really have to have partners that you trust, who are committed to the work and are on the ground on a daily basis committed to the work. I think for me, people that have worked with me know that I like to have things planned and I like to make sure things follow a timeline. And so for me personally, global work helps me be more flexible because you have to be, and you have to sort of roll with the punches. So, I was doing 2 studies internationally, and I was supposed to be in Russia for a team meeting and walk through April 1st of 2020. And I look back on those moments and think about the degree of flexibility we had to have doing work in Russia and South Africa and locally. That work just wouldn't be possible without committed partners and also a flexibility and commitment to the work and to see it through despite, at the time, which seemed insurmountable challenges.
Okay, thanks. Laura, and yeah, again, like any examples, partners are important, beyond partners?
Well, one of the things I was going to say is one of the biggest challenges, and I think this is true anywhere, not just internationally, but perhaps especially so with some of the global work, is trust, building trust. Building trust, among the communities where you're working. And so to give an example, I mean, I mentioned, an iron supplement, for instance, and a lot of the places that we work, we go in and we have one group that gets, a certain type of supplement and another group that gets another type of supplement. And if you haven't built the trust, and we do that in various ways, one of them being partnering with local individuals who are, really well regarded in the community. But what can start to happen, and we've had this happen, are some rumors about what's actually in the pills that we're giving out, right? That maybe they're not really just iron supplements, and maybe they're not really just vitamin A or vitamin D. And so that can start to circulate. And depending on where you are, this is maybe an extreme example, but it's happened. It can be dangerous. So, I have had my vehicle pulled over by armed individuals, threatening, because of what they heard and what they thought. And it really was our partners who were with me in the vehicle who defended what I was doing and the work that we were doing there. And so, there are lots of different types of challenges that you can encounter.
There are other logistical issues also, like time and language, and also like disasters coming up. So I am working on one project which involves the people from Israel, from Russia, China, and UK. So sometimes the logistical issues also becomes a challenge. And I remember sometimes I have to get up at 6 a.m. for the meetings. So you have to have that flexibility. Sometimes there is a political challenge also depending on the population. For example, if you're doing something with the women and there are gatekeepers and the political gatekeepers whom they do not allow the women to talk on those topics. So having the community partners, I say, the local partners are very essential, that what kind of local partners you have and what kind of programs you are developing. And if you have some support from the political gatekeepers also, that also helps in actually implementing that project and making it more culturally sensitive. So like lot of things, lot of issues, language, how you communicate, how you pass those gatekeepers, how you convince those gatekeepers, those are another challenges but having appropriate local partners does help. But there are again power and politics issues. Yeah, a lot of.
Great discussion. Thank you, panel. I have two questions. One is, I'm thinking about the distance that you have to go, like literally and also figuratively, right? So one is a physical distance. So in-person collaboration, like actually flying over there to do the work in person versus virtual. Do you see differences in your effectiveness as a team? I would love to hear, stories. The second thing is cultural distance or differences. So when you actually do encounter that, what are some of the major, barriers in terms of the cultural differences that you have encountered, and how did you overcome that?
I can kick us off. I think it's so important to think about both strategies with the international work and then also, traveling there, but then also how are you going to keep in touch? And that really varies by team. I just got an email from my South African colleague this morning, Lochner, and I know he sends it to me at the end of the day, and I've got a window that if I reply, he's going to see it before he goes to sleep. And so some of it's just kind of a logistical and figuring out what works. I think it's so critical, though, to be there and to meet with the team, meet with people, see the community you're going to be working with. It's absolutely, in my mind, essential. And so then you also think about how many trips am I going to make there? Who's going with me? How long are we staying? What are we doing when we get there? So I think you have to be very thoughtful about how you're going to keep the work going in an authentic way. Culturally, I think you have to have a lot of cultural humility and know that you know so little relative to anyone you're interacting with, and you have to just roll with that and ask questions and be inquisitive, and do things that probably are going to make you feel really uncomfortable throughout much of your time because it's just so new and you're trying to absorb it and trying not to. Trying to understand different perspectives. So I always find some people will be like, "Oh, it's so great! You're taking a vacation to South Africa," and I'm like, "No, this is it's hard work, it's long work, and it's really rewarding work too."
Double down on that one. Absolutely. Just to tell you a little story, since you want the story, I have a very strong and terrible memory of going to Senegal, and so. It's an overnight flight, so you don't sleep very well. It's maybe 8 hours, so you sleep 4 or 5. I land in Senegal in the morning, no breakfast. We get in the car, drive 6 hours to the town where we're actually going to do the work, and I was starving because I didn't eat. No breakfast, no lunch, and I can only remember like being starving and really wanted to eat. And I assumed we were going to go to the hotel, take a shower, that kind of stuff. We just went straight into a meeting with a regional director of the Ag Extension Services, so I really had to behave. So sweaty, dirty, starving, tired, and you just have to be up in French suddenly in the middle of Senegal where you just have to do it. A grad student was with me, and she also did great. So that's a little story for you. You cannot replace those in-person visits, though. Absolutely essential. Culturally, be humble. You are going to make mistakes. You are going to say dumb things. I once asked if we could train more surveyors than we needed and then just select the best at the end. And I was looked at with very, very dark eyes that you do not do that in this country. You train 12 and hire 12. And that was another memory of okay, I'm sorry. Just be humble, and people know that you're different, and so that's okay. It works out.
Yeah, and I'll just say, the in-person, you asked about in-person, and I think that's very important. In most of the places where I've done my work, relationships are, you have to establish relationships first, or you're not going to get anywhere. And going and visiting them, just the act of doing that they're so grateful for it. They feel like you have made the effort. You're showing them that you're making that effort. And I tell my students, yes, we can do certain things virtually. I can show you movies. But I always tell them you have to be there, and you have to hear, and you have to smell, and you have to feel, and you can't replace that. There are a lot of things we can do, of course, virtually, and I think, the pandemic has helped us even increase our capacity for doing that, and I don't think that we should ignore those, but I don't think they're substitutes for being on the ground. I'll give one example. Culturally, I was working in a location where I knew that time wasn't valued in the same way that we value it here, right? Like if we say the meeting's going to start at 2, it's going to start at 2, right? I knew that wasn't the case, so I was ready for that. What I wasn't ready for was we had a study where we would send a taxi to go to pick up our participants and bring them to the clinic because, a lot of them had transportation difficulties. And so we would send the taxi when we said, we were going to send it. And it would get there, and not only were they maybe not ready right at that moment, which, again, I was ready for that, but the taxi drivers would hear things like, well, I just started my laundry, so you're going to have to wait. I mean, and at first I thought, what in the world, did they forget that this was their time, And no, it was just, oh, no, you're going to wait until I'm done with washing the laundry, and then we'll see where I am after that. I might be ready to go with you. I might not be. We'll see. And to me, it was like, what? And what was really helpful is one of my graduate students at the time was from this country. And so that was the most helpful thing to me, to have her sit down with me and just say, let me explain. Oh, okay. All right. Yeah. So a lot of flexibility.
Especially when you go to developing countries, they are so much resource hungry, and it's different kind of hospitality that they need, because they need you. They actually see you as a giver, like they want everything, whatever you have, and they respect it so much. So you have to be culturally humble, and sometimes you feel that you are just spoiled by them, and it's a different culture, because I went to Pakistan like after 3 or 4 years, and then I had to give some lectures to them, and they were like at the airport, they were picking up my luggage, helping me, and then like, I have got a very good car to take you to the hotel, and I was like, I was not expecting all those things. But sometimes they give you so much love and so much hospitality, and you have to respect that. And then if you provide them whatever things they need, they are very much resource hungry. So definitely nothing can replace that in-person connectivity and that in-person touch. But then again, respecting their values and respecting the culture is very important, and it gives you a lot of confidence too.
Great. Oh, sure. Okay. Follow up.
Hello. I'm not going to stand because it's kind of tight back here. I was just wondering if figure out how to formulate this. In trying to incorporate diversity, equity, and inclusion in global health research, if you've run into challenges with public policy that may not coincide with people's cultural differences in participating in those studies, and if so, how you navigated those barriers.
It's a huge challenge, and it's a real struggle. So when we were doing, one can imagine, over the course, I've been working in Russia since 2011, there's been a few things that have happened in that country, especially when we start thinking about, unfortunately, very stigmatized health conditions like HIV and substance use. And so you have to be mindful of what those political contexts, because there can be some real ramifications for you as an investigator, but also for your teams. And so, for example, there was legislation or decrees, however you want to view it, that Russia did not have any LGBTQ individuals, and that was, for lack of a better way, outlawed and not to be talked about. And certainly when you're working in a space like HIV, that becomes a real challenge. And so you have to be really thoughtful about what you know is right and important, but you can't also put your team at risk for some pretty serious consequences. So unfortunately, you have to do this dance because of just laws or consequences, but it sort of pushes you to think about how you can still keep the integrity of the work and be committed to work that's responsive in spite of really challenging circumstances.
So can I just follow up then? What did you do? Like, how did you find participants?
We had to take a compromised position. So we had to, there are two things you just have to interpret. Our local team had the real sense that their offices were being recorded all the time. Now, whether that's true or not, I don't know, but I'm gonna take them on their word that if they're concerned about that, I'm concerned about that. So we would have conversations outside where we would discuss things. We wouldn't put certain things in writing as protocol or policies, but internally we would have an understanding of what we were going to do. But could you find that written anywhere that somebody could pull it off of the web? Absolutely not. And so, when we would give presentations, we also wouldn't talk about certain things that they were uncomfortable with. And so sometimes that makes you feel a little uncomfortable to not be as, upfront and behind that. But, you have to do the dance of, that this could have some really negative consequences for your participants and the people you're collaborating with, and so you have to protect them.
Jonathan, you want to?
I don't think I have. I've never been in that situation. And my work is consensual enough in that sense that I've never run afoul of any kind of policy. I mean, food safety, everybody's for that. In Bolivia, I had a project on payment for ecosystem services, which is a type of environmental conservation programs, which is not legal in Bolivia. But basically our partner, and again, the importance of working with the partner has a whole framework and has a way of presenting its program in a way that is that makes it legal and okay. So we kind of just followed their lead. And they were implementing the program anyway. We were just there to kind of evaluate it or work off of it. But I've never really had any issue to that.
Yeah, we've had some issues. I'm thinking of a project that I did simultaneously in 8 different countries. And the part of what we were trying to do is use the same protocol, in all 8 countries so that we could compare. But every country is different, and every country has different rules and laws and policies, like you're saying. And in one spot in particular, it was really difficult when we were using any questionnaires that were assessing mental health issues, and then delving deeper. So there's one in particular looking at depressive symptoms, asking about suicidal ideation, and delving a little bit deeper and maybe getting into questions that might start getting at domestic violence. And in some of the settings, there were systems in place to be able to report that, to be able to have someone, follow up. In other places, we don't talk about that. It was not acceptable to talk about, and if you, in fact, even asked, and I think Jenny was saying, that if you raised a concern, that might put the participant at a higher risk. And so, then we had to think, what do we do in this situation? In that particular situation, because I'm anticipating Cammie saying, what did you do? In that particular situation, what we decided to do is form a support group of women in this village that were trained to be able to go and talk with the individuals. And that was the way that, because we didn't feel that we could gain this information and just walk away. And so again, in many places, our protocol said, even if they didn't, let's say for the depressive symptoms questionnaire, even if they didn't reach the cutoff, if they answered yes to the suicidal ideation question, we're not just walking out and saying, thanks for the data, right? And so we had a referral system and a way to follow up. But again, in the one country, it was really taboo to even talk about this. And so we decided, working with our local partners, to form this group of women that could serve as a support group. So it wasn't sort of the official, we're not reporting you to anyone, but there is this group here who, can serve unofficially. So that's what we did in that situation.
I kind of not being in that situation directly, but I remember that in the current project that we are doing between 4 countries, looking at spiritual competencies at the end of life care. So I remember when we were developing the instrument, the survey instrument, so there were some questions where the partners from other countries were mindful of using the question as it is, and they wanted to change the question because that was something sensitive in their own country and in their own culture. So I think it's very important when you're developing the instrument, how that instrument is taken for data collection in that specific country and that's in that cultural environment. Contextual environment is very important. So, yeah.
Thank you. I'm going to skip again. Oh, there's another question. Okay.
Thank you. I have a follow-up question on about the protocols mentioned by Dr. Murray Kolb. So I was just wondering, I think I can understand the importance of trying to use the same protocol so you can compare the results from different contexts, but I can also imagine situations where some things we are trying to study can be very different depending on the cultural context. So I was just wondering, how did you develop those protocols? Did you develop them within the US context and try to generalize them to different cultural contexts, or did you try to develop those protocols from the specific cultural context?
That's a great question. So what we did in the example that I was giving in the 8 different countries, we had researchers, colleagues within each of those settings. What we did was we brought everybody together, and it took a long time to go through, every single scale that we were going to use. And I mean, it took a long time. It was, long 10, 12-hour days of literally scale by scale, question by question, going through and figuring out, will this work in your context? If not, how does it need to be adapted? Is it even appropriate? And so a lot of preparation, on the front end. In the end, I think it was well worth it. But when you're in some of those long days, you're thinking, is this, are we getting anywhere? But that's how we did it.
The other thing I'll just add is that it may also depend on the type of work you're doing. So I do a lot of human subjects research. And so it's always been my stance that I want to use the in-country IRB because I've had some funny things. I had the University of Cincinnati once tell me that my use of third person was inappropriate. And I said, well, that's nice, but none of these questionnaires will be in English. It's perfectly appropriate in this cultural context. And it's a small example, but I think the other is thinking about what are the regulatory or oversight bodies, and then they may have some things to say too about the protocol and making sure it's appropriate for the context you're working into.
Thanks. I'm going to start with you for another question, which is number 9, which is, based on your experiences in conducting global research, what would you say are the most common ways in which researchers and practitioners perpetuate racism or lack of inclusion in other areas?
So one is lack of awareness, and sometimes we have our own implicit biases, our unconscious biases, so we are not aware of that and not using the appropriate adequate language, developing the survey instrument not as per the context requirement. So those are some of the areas where that can perpetuate the racism. And also, as we discussed about looking at the policies, that how those policies or how those things are being understood in that context. So that is very important. If I do something having the population LGBTQ in Pakistan or India, or maybe in a very conservative religious group, I have to be very careful because that might not be allowed for me to do there. So being conscious of those important political and religious things and those sensitivities is very important to be aware of.
Racism,
Sure.
lack of inclusion?
Well, I was going to say, I think a lot of times we tend to do things the way we were trained, and we don't always think about it. We just kind of keep doing it the way we were trained, right? Or the way we were told, or, someone told me, I'm going to use an example from nutrition, we'll say if your blood value is, below this cutoff, you're deficient, for instance. And sometimes we assume that there's a really good reason for that cutoff. And a lot of times when you dig into the literature, you realize maybe there's not such a solid reason for it as much as I thought, And so that's just one little example is I think that we're just so used to, this is what I was taught, here's how I was trained, and it worked in whatever context maybe you were trained in. And I think we need to learn to question some of that. and to figure out, where did that come from? Is there a really good basis for it? And maybe there is, but maybe that can't then just be applied to another group, another setting, another culture. And so some of the times, I don't think that people are necessarily doing it purposefully, but I think we just tend to, here's how I was taught, and now I'm going to go out and do what I was taught and get on with what I'm supposed to do and build my career. And so I think some questioning is good.
Thank you.
I would mention the term of parachute science. I don't know if you're familiar with it. The idea of a researcher or a team of researchers kind of dropping into the community, doing their research, collecting that data, and then leaving right away and never actually communicating any of the results back. It's probably not racist, but definitely not inclusive. And I'm guilty of some of that as well, right? It's difficult when you're back, you're here analyzing, you get your publication, you're happy, you kind of close the project in your mind. It takes effort, it takes time, and possibly money to go back to the community and communicate your results in the proper language and context and I don't know what else, but in the proper way with the communities in a way that is actually useful to them, not just to me as writing a paper and checking a box.
That's a great question. I oftentimes think, I perhaps am being viewed as a representative of fill in the blank, right? So, it takes on a different level that now people are seeing me as, I think about working in South Africa where I predominantly work with Black South Africans. And there's such a long-standing history of oppression and racism. And I embody that, even though I've never lived in South Africa. And so with that, I think it's a great responsibility for me to be thoughtful and think through and understand how, if somebody doesn't want to talk with me, that's probably for a really good reason. That has not as much to do with me as a person, but of this long-standing history of racial oppression that Black South Africans have experienced. And so I think it becomes so important to be mindful and listen. And if somebody tells you this is not going to be okay, you say, okay, absolutely, we will not do it that way. You tell me what would be more appropriate. And then also to, show up and show up in ways that are important to them and maybe less important to you. So we were touring a facility of one of our community partners, and they had planned this whole day, that sort of same scenario where you're exhausted, you just want to sleep, you're jet lagged, and you're so thirsty, and there's no water to be found. And then all of a sudden they said, and we would like you to be on our radio show. And I said, sure. That was not my internal dialogue. It was panic. It was a lot of things. But I think, that's what they wanted me to do in the moment, and so I did it, right? And I think you just have to keep showing up and be faithful, and especially with resources, I'll do anything to write a grant for my South African colleagues because that means 4 people are staying employed. And that's it's just important to keep doing the work and to show up and be accountable.
That sometimes, because I'm a qualitative researcher and I go for interviews and I kind of in-person contact with the people and for collecting the data, it's very important that how you control your non-verbal gesture and also your attire. Because I remember when I went to a hospice setting, it was very important for me to dress up in that country dressing, and because it was a very, very poor population, so I cannot wear something fancy or something. So you have to be very careful about your own attire, your non-verbal, and also be sensitive to which context. If you are going into a hospice setting, you have to be careful that people are grieving. They are going through a lot of trauma. So how you communicate, your language, how you speak slowly, and also if you cannot speak in their language, how to. So all those little things, sometimes we do not pay specific attention, but those are very important because those are the things that will help you developing that trusting relationship, and to prevent that power differential between, like, giving them a sense of equal participation between the researcher and the participant. If you fail to develop that kind of trusting relationship, or if you fail to prevent that power differential, you will not be able to get the data, the enriched data that you actually need for your study. So those things are also very important. And like being a supervisor, we need to tell our students to be careful about those things. So, yeah.
Thank you. I'm mindful of time and that we can continue the conversation later, but I need to end with this question, or at least any follow-ups. So what suggestions or advice on best practices do you have for colleagues or students who want to incorporate more of a global or health equity perspective into their work or go into this field? Jonathan, can we start with you?
Don't be afraid to do it. I don't know if that's such great advice. I'll come back to the idea of a partner. Find a way into the country or the community that you want to work in. Concrete example, I started working with a grad student in the School of Hospitality and Tourism Management who's from Nigeria, and he's extremely passionate about doing something for the benefit of Nigeria. And he's great. He knows people there. He was employed actually by a national research institute, so he actually has very practical. I realize I'm very blessed in that sense, very lucky. But kind of work through networks and contacts, find a point of contact in the setting where you're interested in working, and then that will open up all kinds of doors for you. And then, after that, you need a lot of other things, but if you have that contact who's passionate about it, that will make all the costs bearable.
Jenny?
Try and learn from people who are doing the work, their lessons learned. I was very fortunate to, as a postdoc, have a mentor who sort of took me under his wing and said, we're going to do this study in this place and you're going to be in charge of it. And I would say, huh? But yet, you sort of learn by doing and practicing for people that have done this work before. So I think learn and have an open mind about the work and the challenges of the work. And I also would argue, some of the same principles apply to domestic work. It's just your way of thinking and approaching how you're going to interact with community partners or stakeholders, and thinking and learning from people who have had experience in that area.
I would say that self-reflexivity is very important. So first of all, follow your passion. Don't be afraid. It would be difficult to go into the field and find the right people. So having the right local partners is very important. But besides that, your own self-reflexivity. So what I do the journal keeping. For my all research things, and what kind of obstacles, barriers I went through in this research, or if I do some interviews or something like that. So kind of self-reflexivity is very helpful, keeping journals. And it also helps you keeping away your own biases and prejudices, and being aware of the environment and of the people where you are going to do the research. And having some trainings and a good mentor is absolutely very important.
Yeah, I would say be ready to listen, and you have to be flexible. You have to be adaptable. Things are not going to go the way that you planned. I also am a planner. I love to plan. I like to have everything scheduled, and it's just not going to go like that, and that's okay. And so I would say, be willing also to be vulnerable. You're going to be in situations where you're going to feel uncomfortable, and that's all right. Learn from those situations, and be as open as you can be.
Thank you. Do we have follow-up questions for anybody on the panel?
Have a plan. Make the plan. Make sure you have the plan, but be okay when nothing goes according to plan. But make it first.
I know some people in this audience, and I know several people also have global health experiences, and I'm just really glad you came today, and I hope that we stay around, have snacks together, and chat more about this. And I'd just really like to thank the panel very much for participating today. I've learned so much. Thank you so much.